Hi, everyone. My name is Azin Pooresmaeil, and I am one of the dental fellows who is doing research with LDI this summer. Thank you so much for allowing me to present remotely. I really appreciate your flexibility. So this summer, I was approaching dental anxiety at Philadelphia Fight, and I worked with Dr. Titania Strauss and the other dental providers at Philadelphia Fight to explore how dental anxiety is reduced there and how it presents in patients at the clinic. So my goal was to develop a protocol for dental providers to use when treating patients with high dental anxiety. Philadelphia Fight is a organization that provides comprehensive healthcare for those who are suffering with HIV and AIDS or who are at high risk for HIV and AIDS. So I specifically was curious to look at this population and see how dental anxiety manifests there. And I wanted to create sort of a reference guide for providers at other clinics or at other healthcare organizations to use when treating patients with dental anxiety, just something to look back to and reference and have a list of approaches and steps to take when treating these patients. This was really important because dental anxiety is very, very common. About 36% of people in the United States present with dental anxiety. So let's say there's about 45 people in this room right now. That's a third of the room. That's about 15 people in the room. 1 in 7 of the population present with severe dental anxiety. Severe dental anxiety is when that dental anxiety really starts to impact how you are taking care of your oral health and how often you're going to the dentist. So on the left is kind of a visual of what's called the vicious cycle of dental anxiety. So dental anxiety is almost like a positive reinforcement loop. A patient presents with dental anxiety, which is going to cause them to avoid the dentist. Avoiding the dentist is going to lead to more dental issues, which is going to lead to them needing to actually go to the dentist more, or going to lead to really severe pain and going to the dentist to treat something specific, which is that symptom-driven care, or just to alleviate one specific problem. And in turn, this leads to more and more dental appointments that the patient, unfortunately, because of their anxiety, might continue to end up avoiding. So the methods I use at Philadelphia Fight to explore dental anxiety were kind of grouped into 2 different buckets. First is I really want to explore what are the roots of anxiety. So why are we seeing dental anxiety manifest in these patients? I did a literature review of 4 papers. I just read these 4 papers to kind of get a general understanding about why patients might present with anxiety. Second, which was kind of more of the main portion of finding the roots of anxiety at Fight, was interviewing the staff. So I asked 2 questions and just kind of gave the staff free rein to answer as they felt. The first question was, when do you see dental anxiety manifest most? And the second question was, how do you approach patients with dental anxiety? So I want to get a sense of where are they seeing this anxiety and what do they do about it? I spoke with 4 dental providers, 1 dental hygienist, and 2 dental assistants. The second bucket I looked at was anxiety reduction mechanisms currently used and future suggestions. So what is currently being done at Philadelphia Fight with patients who suffer from high dental anxiety? I looked at that by observing high anxiety dental procedures as well as other general procedures. Specifically, for example, I looked at extractions, injections, and the x-rays. And I just kind of watched and see what the provider said to the patients, how the body language was with the patients, the environment that they created for the patients in order to help alleviate some of this anxiety. And for the future suggestions, I also did a literature review. I read about 12 journals that examined dental anxiety, and I selected what I thought were going to be appropriate for Philadelphia Fight and included that in the protocol as suggestions for what to do when facing patients with dental anxiety. So here is just kind of a quick image of what is a patient's journey, or what is the journey of a patient who has high dental anxiety. So a patient comes in, or a patient experiences some dental pain, starting at that tooth on the left. The first point of anxiety, which is often overlooked, is the scheduling and insurance intake. Patients who suffer from high dental anxiety might find that the intake of insurance can elicit feelings of embarrassment or shame, or the scheduling can be something very overwhelming or triggering, or something that an obstacle that they have to overcome. And this is something that I included in my protocol is, what steps do you take to help alleviate patients with dental anxiety when it comes to intaking insurance or scheduling the patient? A second, also overlooked point of dental anxiety is x-rays. X-rays and the radiation associated with x-rays are a very commonly kind of referenced thing in society, whether that's through like media or anecdotes. But this is a point that might be very uncomfortable for patients. And it's something that I also included in the protocol as what to say to patients, to explain to them how x-rays are important and how the radiation associated with x-rays is actually very limited, dental x-rays. Another step that can be very triggering for patients with high dental anxiety is the examination and diagnosis. Patients who might be feeling, once again, shame or embarrassment or general dental anxiety or dental fear find this point in a dental procedure very triggering, as well as patients who might be fearful of the financial burdens that come with a dental appointment. This point, the diagnosis point, can be something that they're very nervous about. The fourth is injections. Injections are a very common fear, whether that's just in dentistry or healthcare in general. That's something that I reviewed extensively in my protocol on kind of before the injections, during the injections, and after the injections, what the provider can do to help alleviate dental anxiety. And last is just the dental instruments. Dental appointments can be noisy. There can be new noises. There can be unfamiliar noises, or just the general sight and sounds in a dentist's office can be very triggering for those who have dental anxiety. So that's something I also reviewed in my protocol on how to help patients who may be suffering from anxiety due to something related to the instruments. What I found for the roots of anxiety is that the anxiety falls under 4 main buckets. First is perceived lack of control. So a patient might be nervous because when they come into this dental chair, they're not really sure what's going on. They feel like something can go irreversibly wrong, or they're scared that they might choke on something or something bad can happen. Next is the anticipation of pain. Dentistry can be depicted very scarily in media, or through your family. You might hear some anecdotes of dental pain. So patients who might not have experience with a dentist can come in very scared because they're afraid of what they've heard about the dentist. Third is feelings of shame or embarrassment. Your oral health is linked with the health of the rest of your body. So if a patient comes in and they're struggling with their oral health, they might be scared that the providers or whoever's at this dental office might judge them, judge their hygiene, might judge how they're taking care of themselves, their financial status, or their ability to take care of themselves based on their oral health status. The patients might be afraid that the provider is going to say, oh, you seem like you're struggling with your oral health, you're going to be struggling with everything else too. And fourth is trauma from past dental experiences. If a patient has really suffered in the past through at a dental office, if they have had a poor relationship with their providers, or they have experienced a lot of pain or discomfort at the dental office, that can really cause them to dislike the dentist or cause dental anxiety. For anxiety reduction mechanisms used and suggested, this is not a very black and white solution that I found or I looked at in my protocol, and that's because anxiety is unique for each patient. Practitioners should be compassionate and flexible while maintaining the safety of the procedures. So while you can't do something specific for each patient, for example, you might have a patient who comes in who is very phobic when it comes to the sounds in a dental office. One patient might like to be in a room, a separate room that's very quiet, so that might make them more calm and might reduce their dental anxiety. While another patient might prefer to be in a room with the other patients because they find that safety in numbers, but they just want to have their headphones in. So anxiety is really different for everyone. But I did find that there's kind of 2 main things to look at that were very consistent when it came to treating patients with dental anxiety. First is explaining each step to the patient and consistently checking in. We really want to emphasize patient-centered care. The patients should not feel like they're in the backseat during the treatment. They should feel like they are just as important a part of determining their treatment and understanding their treatment. And it really helps to make sure that patients know what's going on so that they won't feel lost or scared. And next is behavior management techniques. So breathing is a common thing I witnessed during the observation part of my summer at Fight. Breathing is something that's very commonly referenced with the providers as well as in journals, and diaphragmatic breathing has been significantly found to reduce anxiety, specifically in the dental setting, as well as guided imagery and desensitization. So just those two things can help patients acclimate to the dental setting, and the breathing can really help patients before or during the dental procedure to help reduce their anxiety and make them more comfortable in the chair. And what kind of came out of this was this dental protocol. I created about a 20-page protocol that's hopefully going to be used at Fight to help patient onboarding of future staff and providers, as well as a reference for current staff and providers. The first part of it includes two main sections. The first is roots of dental anxiety that I looked at 7 different points of a dental visit. So for example, I looked at the scheduling and intake portion of appointment and what are the roots of anxiety there. What do providers and the people at Fight really need to be thinking about when scheduling patients, as well as looking at, for example, during x-rays and impressions, during injections, during the procedures, and even during the waiting period of a dental appointment. Next is the techniques used at Fight to approach dental anxiety and suggested additions. So I looked at those 7 different points of a dental visit as well. And I went through those roots of anxiety, and I said, this is what you're going to do when you find patients who are suffering from this type of anxiety at this point in the appointment, as well as using what I learned during the literature review to select some additions that I thought would be really suitable for Philadelphia Fight. The second half of my protocol was a list of general behavior management techniques and vocabulary substitutions to use for patients with high dental anxiety. So I created a list of breathing techniques, muscle relaxation techniques, techniques that the provider can use during injection, distraction mechanisms during injections that can help reduce anxiety for the patient, as well as these words to substitute when facing patients with dental anxiety. So at Philadelphia Fight, we don't like to use the words drill or pain. We'll opt for the words handpiece or burr instead of drill, and discomfort instead of pain, so that we don't trigger these fears in patients. And what I learned over the summer is that no anxiety is the same. You really have to take the time as a practitioner to get to know your patients and get to know what makes them scared and nervous and really individualize their care. And then the next 2 things I learned is basically my goal at Philadelphia Fight was this quality improvement project, and I really wanted to create the groundwork for future research studies on dental anxiety. This is the first time I've ever kind of come into a setting completely on my own and been like, hey, I'm really interested in learning about dental anxiety. What do you guys do about dental anxiety here? And so I was really given free rein to develop my own research questions. So how do we approach dental anxiety? When do we see dental anxiety? As well as create the foundation for future research studies that will hopefully be IRB certified. And you can start implementing some of these suggestions and seeing, does this actually make a significant difference in dental anxiety? Thank you guys so much for listening. Thank you again for the flexibility and allowing me to present remote. I'd love to thank Dr. Tanya Strauss and the other providers at Fight, as well as Joanne and everyone at LDI for letting me come in and being really flexible with me. If you're interested in seeing the protocol, or if you have any questions about dental anxiety, you can reach me at this email. Thank you so much.